Hello, everybody. It's time for the July update. So, very excited to bring some news to you. On our topics for today, we were, before it was, us paying off our old debt, right? Now we're back to break even. And so, as we have mentioned before, it's really about us looking at, our expenses and the revenue that we generate. And so we're doing some amazing things here. I'm so proud of everybody and how everybody has really embraced this, and we're working together as a collaborative team. So I have complete confidence that we are going to be able to get these things aligned and do them very, very well. So also want to give you the kind of a little bit of update on the kind of the three major KPIs that we're working. Remember, those are key performance indicators. A little bit of a community update, operational update, and then successes to date, as well as recruitment update. So back to profitability. So when we look at our expenses, we are probably a little over 500,000 roughly a month that we need to be able to generate, either generate more or a combination of growth and operational excellence. And so all your leaders, as well as myself, are really working hard to creatively come up with kind of what are the steps to help us try to get to where we actually can be completely solid going forward. Really, I feel like our mission, as an organization, is we have to maintain a healthy organization. We haven't had that in the past. And so we've made so many tremendous strides to move that forward. But now we're really looking at how do we get ourselves where we're solid so we can be here to serve this community for decades from now. And so that's really our primary mission. And so we're going to continue to focus on those things. You'll be engaged in those as we start to talk about growth. And that's one of the things we'll talk about in one of the KPIs. Those are going to help perpetuate that and move that forward. When we think about how we want to do things, sometimes it's about doing things differently. Sometimes it's about doing things with a different partner. And so one of the things on our back end revenue cycle, this is just a little peer into that, where we had contracted about 10 months ago with a revenue cycle vendor, and it hasn't worked out really well. And so we have given them notice. That'll be one of the things that will have some significant savings for us. Our internal team is going to pick those things up. They're excited to do that. We are going to end up with a better product, and it's going to end up saving us about $1.5 million. And so some significant savings. So that's just one example of the things. We've been reducing overtime. There's been a tremendous amount of work on supplies, and that'll continue throughout this year. We think there's probably 300,000 or 400,000 that we can save of not having less supplies or not having not the right supplies at the right time, but us just not wasting supplies and having them expire. And so those are the things that we want to kind of continue to align so that we can really streamline our operations, and that'll help us line up with kind of making that revenue match our expenses. On the community update, I had a great opportunity to meet with Deb Holland, who is one of the kind of two front runners for the next governor. We had, some great dialogue. There was a large group of physicians, and I was invited to participate up in Albuquerque. And I was pleased that she was willing to take the time for us, because it's like a 3.5-hour meeting in the evening. But we got to talk about some real key issues that are important to all of us. And so, one of those is when we think about the Medicaid changes and really how that is going to impact all states, but kind of zeroing in how it's going to impact, rural health in New Mexico. really trying to talk about how do we partner, because in order for us to be successful, the hospital is going to have the ability to partner with the state agencies in a more intimate way, and they have to be willing to do that. When we think about re-enrollment and preserving people on Medicaid, right, we have to actively kind of manage that in a little bit different way than we have in the past. And so, we're going to spend kind of this next year through 25 and then into 26, because those really a lot of the changes aren't happening until the end of 26 into 27. But we need to kind of have a runway, right? So that we have the ability to kind of get our new processes in place. So when those changes kind of go fully into effect, we'll be actually ready to handle that. And we'll be looking at from more of a proactive than reactive stance on that. The other thing really was the big topics were really about physician recruitment and the struggles that we're having across the state. There's not an excess of providers in many different specialties. And so when you have a state that has, a lot of potential liability from malpractice suits and us not having a cap here, it's a big deal for our providers. Probably most of y'all know we lost 2 of our community providers just the month of July. Actually, the 18th was their last day. That was the Andrades. And really the biggest thing was really about the liability piece. And so we were able to kind of share that with her, and we still need to continue to push that agenda, because it is definitely affecting our ability to be able to recruit providers, not only to New Mexico, but definitely in rural parts and rural communities like we are. The next thing I want to talk about really is the KPIs. And so we have really 3 big focus KPIs. They link into our back to profitability. 1 is the swing bed program. 2 is our AR days, or accounts receivable days, and that's how many days our bills are sitting before they actually get sent to the payers. And then the third really is the percentage of patient appointment slots that are fully filled at the clinics. And so both of those are areas that we had some significant room to optimize. On the clinic side, we were on average probably only getting about 75% of our appointments filled. And so we had staff, we had the provider ready, but we didn't have the patients. So we're now in the 90s. We still have to work on no-shows, because we still have probably 10 to 15% of no-shows. And so, you end up in the mid 90s, but then you actually only end up, getting patients 82, 83% of the time actually showing up. And so both of those things are going to continue to have a large focus on that. That is some significant revenue for us right now that we're not fully capitalizing on. Swing beds, really the biggest focus now is looking at all of our area hospitals that do not have the ability to have a swing bed program, and us really advertising and marketing to those places, because they can, after they've had their 3-day stay, they can then transfer those patients directly to us for our swing bed admissions. And so if y'all remember, we talked about kind of our first goal was have a consistent census of 4. We want to do that. These past couple of months, we've had a really low census overall, and so our census has been probably averaging 1 to 1.5 of swing bed patients per day, and so we want to get that north of 4. Also, significant revenue, right, helps us, mitigate our expenses to what our revenue is. It starts to kind of encroach in balancing that off. And the third one is our AR days. It's kind of the same thing if you think about, you having to wait on your paycheck, right? We get paid every 2 weeks, and so we look forward to that. Well, what would happen if you had to go 3 or 4 weeks because it was in the rears? Kind of AR days are very similar to that. So kind of best in class is be less than 45 days. Many pieces are contributing to this. Right now, we're at about 69. And so, we're getting close to almost 3 months, right, of us ending care, right? We discharged a patient and we're almost at 3 months before we're actually getting paid for that or getting those bills submitted. And so we have to squeeze that down significantly. A lot of work across the organization to kind of help, because it's a lot of little pieces. It's not one single thing. It'd be great if that was the case, but we have to really look at all the processes and really try to tidy those up so we can get those in place correctly. Some successes to date. Our door-to-doc and door-to-triage times are both at goal in the ED. Haven't hit that in a while, so that's super exciting. Red Rock Clinic hit the 90% goal for the first month, and that was their actual fill rate, as I was talking about the clinic appointment fill rate, so that was super good. And then we also are starting to where we can have some of our money to build up a little bit so we can start actually investing that a little bit and actually making some interest on those things. Again, it helps us become sustainable long term. And so we're continuing step by step, continuing to kind of progress and move that forward. On the operational updates, we've started to kind of consolidate GI. We're trying to be able to be a little more efficient with that. We want to be able to actually do more per week. So we got our 2 scope towers so that we can actually have scopes happening on the same day with 2 separate providers. We still have limited access, or patients have limited access at GIMC to be able to get scopes done. And so we know there's a big need in the community. And so we're trying to build our processes in place in order for us to be able to meet that need. The other thing I would say related to us really working on trying to build service lines, the telemedicine, we're in the kind of the last throes of that for us to figure out how do we get, like, endocrinology, for instance. Us hiring an endocrinologist would be super difficult. There's not a lot around the country. We probably don't have a big enough population to be able to keep them busy as a specialist in that particular area, but we have significant need. So telemedicine will actually bring that endocrinologist into our community, and we'll be able to really manage those diabetic patients at a significant higher level. We're looking at other areas, telecardiology, telepsych from the behavioral health standpoint, and we'll continue to look and expand that as we look at what the actual community needs are. Last, I want to talk about the physician recruitment piece. Despite all the challenges with New Mexico, we have been quite blessed to be able to have a fair amount of interest still within our facility. And the exciting thing of that to me is that most of these providers have come to us through word of mouth. So it's been each of y'all that a physician colleague and you're saying, hey, Rehoboth is a great place to work. And so it has become, a pipeline for us, which I think is super exciting. We have in the pipeline family practice. There's a number of them. We have telepsychology. We have also a couple of general surgeons. We've got urology. There is a few nurse practitioners that are going to be on the family practice side that will be in the rural health clinic. And so all those are in different ranges of coming on sites or us working with them for contract negotiations in order for us to try to, get us and them to feel like it's a match and us close the deal. So super exciting to have probably about 8 different providers across different specialties that are interested in our area. And we are working very diligently to land as many as we can. So that is your update for July. Looking forward to seeing everybody at the next employee forums, and I hope you have a great and blessed rest of your day.